Hey, real quick, I want to talk about the stages and planes of anesthesia. Again, this is really, really important that you know and remember these. You're going to see these again, but it is so, so important. So start putting this in your mind now. So during your anesthetic monitoring, you need to know what stage and what plane of anesthesia your pet is in. In stage one, that's the period of voluntary movement. Patients gradually losing consciousness. They're going to show fear, excitement, and struggling. They may urinate or defecate. The heart rate will increase, and the patient loses the ability to stand. So they're kind of looking a little bit drunk. They're still responding to you, but they're just looking like they're not quite sure what's going on. Stage two is the period of involuntary movement. This is the excitement stage. This is really normal for them to go through this period, but we really want to move them through stage one and stage two very quickly. They're going to lose voluntary control, but their reflexes will be present. They can vocalize, struggle, and paddle. It can be really difficult to see, but it's also more stressful on them as well. All right, in stage three, that's our period of surgical anesthesia. We have three planes of stage three. Plane one is light anesthesia, and there's some procedures that we can do with light anesthesia. Plane two is medium anesthesia, and plane three is deep anesthesia. Deep anesthesia is where we want them to be if we're entering their body cavity. That's where we need them to be to provide really good analgesia and good medical care. The patient will gradually pass through these planes. You'll see progressive muscle relaxation, decreasing heart rate and respiratory rate. Our reflexes will gradually disappear and the pupils will dilate. In plane one, this is really important that you know the differences between these and where we go from plane one to plane two to plane three. So here are the reflex physiological and behavioral responses you'll see in stage three, plane one. They will be unconscious, so light anesthesia, unconscious. The eyes will be central. They will have marked jaw muscle tone, meaning you cannot open their mouth very well. You get a little bit open, but not very well. And they will move if you stimulate them. So if you are pinching them, poking them, they'll twitch their ear. They may move a foot. That is plane one. Stage three, plane two, your palpebral, pedal, and swallowing reflexes will be gone. So they won't be able to blink as well. Sometimes you'll get a little bit of blink, but when you pinch their toe, they are not pulling back on their leg. They cannot swallow. We definitely want them at this point. You'll have some moderate jaw muscle tone. Their eyes will be ventromedial. So what does that mean? They'll be cross-eyed. So they're looking towards their chest and into the center of their nose, so a little bit cross-eyed. But they will have an intact corneal reflex. What is a corneal reflex? If you touch their cornea, don't do this frequently, but if you touch their cornea, their eyeball will retract back into their head. So that is plane two, stage three. All right, there's a big star here on stage three, plane three, because this is where you want for most of the anesthetic procedures and surgical procedures you're going to be doing. If they're induced with IV agents, patients will reach this plane very rapidly. If they're induced with inhalant agents, it does take longer to reach this plane. Pre-medications will reduce the excitement seen in stages one and two, and pre-anesthetics and induction agents together can alter physical and physiologic responses. So that's why we like to use them. So the reflex, the involuntary, is a involuntary protective response to stimuli that can be used to determine anesthetic depth. Palpebral reflex, blinking of the eye when you touch the eyelid, the corner of the eye, swallowing reflex, pedal reflex, and corneal reflex, those are all things that we're looking at. Muscle tone, their eye position, the pupil size, again, we're looking at those things. So you need to know what stage or plane your pet is, so look at these. So test yourself. One, if they're in excitement phase, they're not aware of their surroundings, but they're paddling and struggling, what stage is that? It's stage two, right? If they're unconscious, that tells me already we're stage three, right? Eyes are centrally located, pupils are dilated, and we have moderate jaw tone. Look at that jaw tone. It's moderate jaw tone. It means we're in stage three, plane two. If they're wobbly, can't stand, excited, nervous, struggling, they're reacting to you, that's stage 1. If they're unconscious, we already know that's stage 3. We have no jaw tone, palpebral reflexes absent, the corneal reflexes present, stage 2. If the corneal reflex is absent, breathing is stopped, heart rate is stopped, the muscles are flaccid, that's stage 4, guys. It's death. Okay? If they're unconscious, we have mild jaw tone, absent palpebral reflex. That's stage 1, plane 1. So know these stages, know these planes, understand how this anesthesia record is put together so that you can monitor this pet, but not only monitoring the pet properly and looking for trends that can lead to problems, but also that you have a medical record for later if the patient is home and something happens, you can say, well, absolutely perfectly fine during surgery. Not sure that's not where we had this problem occur. So we want to make sure that we have that on record. That's it, guys. Thanks for watching, and we'll talk to you soon.